The speedboat ride takes about 8 minutes from Ijegun-Egba jetty to Ibeshe in Oriade community. The only primary health center in the neighborhood looks deserted. These pregnant women came around because we requested to speak with them. It's supposed to be an antenatal day, but the pregnant women are not having a session, as is the tradition with other functional PHCs. The 10-bed capacity facility is not occupied. It has no resident medical doctor or a professional nurse. We are also told the community lacks electricity supply, and neither does the primary health facility own a generating set. The women say they are forced to go to traditional birth attendants because nurses are not always available at the health center.
Nurse standard nurse tó máa dúró tì wá níbí báyìí. So
the center lacks qualified nurses that will be available all the time. The government ought to make it convenient for medical staff willing to work here and take care of their boat fare allowance. And because nurses don't often come around, that is why we go to traditional healers and birth attendants.
Ìgbà tí nọ́ọ̀sì ò bá ti wá sí hospital déédéé, à ń lọ sí ọ̀dọ̀ wọn alágbo.
Traditional herbs are good. It also helps the unborn child. We use both the traditional herbs and orthodox drugs. This makes the job of the nurses easier during childbirth.
Throwing light on why they patronize TBAs, they explained that during emergencies when they are referred to a hospital, the tedious journey out of the waterside discourages them.
When you come to the health center and there's no drugs or equipment and no doctor or nurses, and you have an emergency, how do you get out of this riverside community? That is why it's convenient to go to traditional birth attendants close by you.
Ìdí nìyẹn tó fi jẹ́ pé mo fi ní bóyá mo prefer pé kéèyàn lọ sí traditional ju ìjọba lọ.
If they know say this nurse no fit do this thing for woman, so in person go call the person come.
If the family know that the nurse cannot help the woman during difficult labor, they will call a traditional birth attendant to assist, and the traditional concoction will be given to the woman to drink, or when she is losing a lot of blood after childbirth. It is very effective. I can testify to that.
And for me, so it don't happen for me.
We are told on the average about 30 children are born in the community every month, and just 2 are brought to bed in the health center. The women here are petty traders and cannot afford to hire a boat. And even if it were a free sale, this singular access road that links Lagos-Badagry Express Road remains a bottleneck, either in the wet or dry season.
Usually I discover that women go into labor in the night. Most babies comes in the night. Now if a woman should fall into labor and the husband doesn't have a car, how will she be able to get a transport from here? But if this road is okay, they can easily come out, they can easily get transport. So if the government can repair this road, in fact, it will solve a lot of maternal health problem.
Every 10 minutes, a woman dies of complications in pregnancy and childbirth in Nigeria. Nigeria ranks second in the world with the highest rate of maternal deaths after India. Most of these deaths are preventable. Vivienne, Irikefe, TVC News.